Happy Wellness Wednesday and welcome to November. I still can't believe we are this far into the year. It is crazy. This year I feel like has flown by so quickly. I wanted to give you a little information on what we've got going on this month. So November is when daylight savings times ends. That means the days are getting shorter and colder because we live in the Midwest. One of the things that we're going to be focusing on this month is talking about vitamin D because I think vitamin D is one of the most overlooked nutritional deficiencies that can affect so many different body systems. In the Midwest, there's only about maybe 2 or 3 weeks of the whole entire summer that the sunlight is at the perfect wavelength for your body to make vitamin D. That means that most of the year, matter of fact, about 90% or more of the year, you need to be taking a vitamin D or getting it from food sources to make sure your body has what it needs. I'm seeing a lot of patients coming into my office right now with vitamin D deficiencies, and that affects so many different body systems. So, number one, when you have low vitamin D levels, your body doesn't know how to send calcium into your bones and also phosphorus into your bones to help them stay nice and thick and dense. That means that we can see osteopenia and osteoporosis issues when we have vitamin D levels that are low because your body doesn't know how to direct calcium and phosphorus into the bones and we can see them thin out. The reality is, if you're only taking a vitamin D and you don't have any vitamin K to help direct the function, or you don't have any fat soluble vitamins, your body may struggle to absorb that vitamin D. So it's really important if you're taking a vitamin D, you don't just take a vitamin D, but you need to make sure you're getting a fatty acid and a vitamin K so that that vitamin D is going into the bones and where it needs to, because otherwise that vitamin D, if you're only taking it by itself, can actually direct calcium to go into your organ systems, causing calcification, to go into your joint spaces and your ligaments and cause calcification and bone spurs and arthritis. And it can also go into your arteries and cause calcifications that can lead to heart disease. So vitamin D deficiency, huge issue. If you're taking just a vitamin D without a fatty acid and without a vitamin K, that can even cause more issues for you. So it's very important to realize that vitamin D is important in your body for a lot of different reasons, but you also need to make sure you're taking the right kind and getting the things it needs to actually distribute it properly. Now, vitamin D actually targets about 2,000 genes. That's about 10% of the human DNA genome that is targeted from vitamin D. That means that if you have vitamin D deficiency, that is going to increase your risk factors, and that's a major risk factor for not only 17 different types of cancer, but we also will see heart disease, stroke, hypertension or high blood pressure. We can also see autoimmune conditions from that. We can see diabetes, depression, anxiety, chronic pain, osteoarthritis, osteoporosis. We can also see even birth defects linked with that, and also periodontal disease or tooth decay. So that vitamin D is super important to make sure your body has for a lot of different systems. So bones, muscles, organ function, immune function, you name it. Now, one thing that's really interesting is low vitamin D levels have actually been associated with muscle wasting and muscle atrophy and even muscle weakness. So if you're experiencing muscle weakness, if you've lost muscle mass, you're going to be putting more pressure on your bones. And if you don't have enough vitamin D, they're likely going to be weak. That's going to increase your risk factors for having a compression fracture. So it's very important to make sure you're getting enough vitamin D. Vitamin D has also been linked with mood disorders as well. So we can see winter blues or seasonal affective disorder, SAD is the short term for that, or even increased depression issues that we tend to see in fall, winter, and spring, especially in the Midwest. So vitamin D is super important. And this month we actually have a special going on. So we offer vitamin D testing. We can order that test here in the office. You can go get your labs drawn and we can figure out what your vitamin D level is at. And depending on where it's at, we can even make recommendations on how much vitamin D and how you need to take it so that your body has what it needs to get that level back where it needs to be. And like I mentioned, the vitamin D that we carry in our office is special. Not only does it have a medium chain triglyceride, the fatty acid, to help it absorb better, but it also has a vitamin K2 to help make sure that vitamin D is going into your bones so that we're helping with bone density and we're preventing muscle loss. And we're also going to prevent any calcium deposits in your organ systems, in your joints, as well as in your arteries. So very important that you have a good quality vitamin D. A lot of the ones out there don't have those things in there, and we can actually see more problems with them. And then also this month, like I said, we are focusing on vitamin D, but also sleep, because vitamin D and sleep, we need vitamin D to kind of, we call it the sunshine, but we're also going to talk about the dark side, especially since it's getting darker. We're going to be talking about sleep. So this month, next Wednesday, November 9th, we're going to be talking about great sleep without medication, how you can actually help your body and your hormones to get in the right balance, and things you can do to help make sure your body has what it needs to get great sleep, as well as testing or even some sleep aids that are all natural and non-addictive and non-drowsy that can help your body get to sleep faster. The week after that, Wednesday, November 16th, we are going to be talking about sleep tips, as well as talking about Relax and Calm, which is a natural sleep aid we carry in our body that actually helps with adrenal relaxation and lowering cortisol levels for less stress. And it keeps you alert throughout the day. And then at nighttime, it actually can help with improving and getting you to sleep faster and sleeping longer as well. On November 23rd, the Wednesday right before Thanksgiving, we will have some healthy twists on Thanksgiving recipes to give you some tips on how to transform those Thanksgiving side dishes to a little bit healthier versions. And then on November 30th, we're going to be talking about balancing hormones for better sleep. So make sure you tune in. We have a lot of great stuff going on this month at Health and Horsepower on our YouTube channel. And if you haven't been to our website, we now have a new specials page that features what we've got going on this month, including a monthly help tip of the month, which this month it's get your vitamin D level checked, because we talked about it already, why that's super important. So make sure you tune in every Wellness Wednesday. We go live at 5 with a new video and a new health tip to keep you healthy and your family staying healthy for the long run. So have a great rest of your day. We'll see you next week.